All right, that is the situation. And of course, from what we are getting, consultants have now withdrawn their services from the Kenyatta National Hospital, leaving, I think, the KDF to operate on some of the emergency issues that are coming up in the hospitals. And the nurses and doctors have insisted they will continue with their strike. But to put this into perspective, let's now link up with our senior reporter, Rita Tinina, who's joining us from our City Centre studios. Good afternoon, Rita. What exactly does this withdrawal by consultants mean for this particular strike by both the nurses and the doctors?
Well, Akisa, as you mentioned earlier there, these consultants met in the morning from as early as 8 a.m. in the morning. 300 of them met at the parking lot of the Kenyatta National Hospital. And among the resolutions that they came up with was the withdrawal of services at the Kenyatta National Hospital. They argued that since the doctors kicked off their strike last Monday, they are the only ones who have been working together with KDF personnel at the hospital. And they say with the absence of the doctors, the backlog has been huge. And they are saying within the last 1 week, the government has not shown any goodwill to try and resolve the crisis with the doctors. And so they're saying now they will join the doctors in this industrial action. So they are saying they will withdraw their services for one, the services including both in the private wings, in the public wings as well. Just as the demands were made by the doctors, they want, if they were to return to work, they want the return to work formula to include the collective bargaining agreement, which was signed in 2013, to be implemented in full and with arrears. This is a collective bargaining agreement in which the doctors were promised a 300% pay increase. And last week, during negotiations with the government offered about 50,000 shillings to the doctors in class L and M, and this the doctors refused. They declined that offer, and they also those talks collapsed. The doctors walked out demanding that the court cases that have been instituted by the Council of Governors be withdrawn. And the consultants today in their press statement are also demanding that those court cases be withdrawn. They are also advising that other hospitals should not make any referrals to the Kenyatta National Hospital. They also want the KDF personnel who are there to be withdrawn. They argue that those KDF personnel are only offering basic services. They say they are no specialists from the KDF. And they're saying that what they do, the KDF personnel, is only to admit patients to the wards, and they're not making follow-ups of those patients. They say since last week, since the KDF has been dealing with the patients, several of them have died. So for now, withdrawal of services means that the quality of treatment, the quality of care from the Kenyatta National Hospital may go down. And what the consultants are arguing is that without the specialists, they are saying perhaps with the KDF personnel, you will not find oncologists, you will not find cardiologists, you would not find the number of pathologists that would ordinarily be working at the Kenyatta National Hospital. And they say with the withdrawal of specialists, what that means for the Kenyatta National Hospital is that it will be reduced to a level 4 or 5 hospital. There are only 2 referral hospitals in the country considered as level 6 hospitals, the Kenyatta National Hospital, as well as the Moi Teaching and Referral Hospitals. So the withdrawal of these services, meaning that the Kenyatta National Hospital will not be able to offer the services it has been able to render in the last 1 week. Those services in the last 1 week also have not been at the optimum as compared to when the doctors were working. Akisa.
Well, the consultants are asking for the withdrawal of the KDF health workers out of hospitals. What exactly are we facing right now with the nurses out, the doctors out, and now the consultants out? Are we looking at a likely complete paralysis of operation at the Kenyatta National Hospital?
Well, the crisis began last Monday when the doctors began their strike, but at least with the consultants working over the last 1 week, over 1 week, the services, when offering basic, what they say basic minimum emergency services, the hospital has been able to handle several cases, even those that have been referred from other hospitals. But now with the withdrawal of these consultants, it means that KDF personnel are the only ones left in the hospital, meaning that withdrawal of doctors saw some crisis. The withdrawal of the consultants means that the crisis will even be worse since the KDF personnel who are not able to handle as much as the consultants will be handling. Akisa.
Thank you very much for that. That's our senior reporter, Rita Tinina. And as she says, consultants have now withdrawn their services from Kenya's largest referral hospital, which is the Kenyatta National Hospital. And they are demanding that health workers from the KDF should be withdrawn from the hospitals.